All right, so want to demonstrate a little bit of the difference between the different types of BFR cuffs that are out there. There's several to choose from, but a few of the main distinctions to keep in mind when you're looking for the type of BFR cuff that you want. One of the main differences is width and type of material that makes up the different types of cuffs. So here we've got a few different ones. This is called a BFR band. This is one you can kind of order off of Amazon. This is what I used when I was in PT school. It's cheap. It's a rigid cuff, so it doesn't have any elasticity to it. So you put it on, it stays in the exact same spot. The problem with this type of cuff is that it's not regulated. You don't know how much occlusion you're getting. It's a little bit uncomfortable. And realistically, it's hard to get full occlusion with this type of cuff, so it's not as big of a safety concern, but just from a professional standpoint, you don't really know exactly how much occlusion you're getting. And so if something were to happen, even if it had nothing to do with the type of cuff, you just don't know that you weren't fully occluding. So from a professional standpoint, it's a little dicey to use one of these. But again, these are kind of the cheap Amazon belts that you can use. Then there's a bunch of bands that are similar to this sort of thing. This is called an occlusion cuff. There's a lot of other brands that are similar to it that have this kind of single bladder system, so that when you pump it up with a cuff, it'll just gradually apply more pressure, just like a regular blood pressure cuff would. It kind of gets this long sort of tube thing, so it'll kind of fit around your arm. Again, with these sorts of systems, you don't know exactly how much occlusion you're getting, so most of them will include a Doppler with them that you have to use to check. So you put it on, you pump it up, you find the artery, and then you pump it up until you get to the point where it's at full occlusion. Then once at full occlusion, you back it off to whatever percent you are desiring to have it at and leave it there, and then do your exercises. So, those cuffs work pretty well. The only downside of that is that, again, they can be a little bit uncomfortable because it's this rigid system. It doesn't have any give to it because once it's filled up with air. Most of them tend to be this kind of narrow type system, which means that it requires more pressure to get full occlusion versus the wider systems that cover more surface area, so they occlude faster. But those are kind of the main differences between those two. Then there's this B-Strong system. And this is kind of a combination of a couple different sorts of systems, similar to the Katsu system, where it starts off as this kind of rigid type of belt that doesn't have any give to it, a narrow type cuff. But then when you inflate it, it's got this barrel system on the back of it, so that when it's inflated, it's got a little give to it. So I'll show that to you real quick here. If we pump this cuff up all the way and then remove it, then the band has a little bit of give to it. So it's got a little elasticity to it, so that when you're doing your contractions, your exercise, it's got a little bit of give to it so that it's a little bit more comfortable, but also that's what makes, at least with this particular cuff, to keep it from fully occluding, which is, the main thing to keep in mind when you're doing any kind of BFR exercise is making sure that you're safe. So with this cuff, even when it's fully pumped up, it cannot fully occlude. So from a safety perspective, from a clinical perspective, these are nice, especially being more affordable than some of the other sorts of bands out there. So these are some of the ones that we like the most. There's a couple other systems out there. Of course, there's the Katsu, which was the original, which is, again, an elastic band, kind of similar to the B-Strong bands, but it's elastic all the way through. It's got an elastical tubing on the inside, elastical cloth on the outside, or elastic cloth on the outside. Which allows it to have a little bit more springiness to it. And then there's other cuffs that are wider, more rigid, kind of a modified surgical tourniquet that are real wide. And those are good just because they're kind of automated, but again, they're very expensive, and they can be pretty uncomfortable too because it covers a wide surface area, and it's a rigid cuff. So when you try to contract against it, it doesn't give it all. And so that makes it more uncomfortable and just not as much fun to use. So then the other thing I wanted to show you is kind of where to place the bands, how to put them on somebody, where you're going to put them regardless of what kind of cuff you're using, just kind of the actual placement of the bands themselves. So I'm going to have Josh come over here and I'm going to show you how to put these on real quick. So whichever type of band you're using, whether you're using one of the smaller ones or a bigger one, this is one of the leg bands. So regardless of what type of cuff you use, you want to put it as high on the extremity as you can. The whole point is to try to restrict the amount of venous blood flow that's coming back up in the limb. So regardless, even if you're trying to work your calf muscles, the higher up you are, the more blood flow restriction you're going to get. It's also safer. The further up you are, the less likely you are to occlude at some of the venous structures that are more superficial in the knee or the elbow. So if I'm putting this cuff on Josh, what I'm going to do is I'm going to place it as high as it'll go, kind of up on the leg here. And then we're going to kind of angle it up so that it stays nice and high. With this cuff, you want them all to be pretty snug. So you make it snug, pull it around, and then it just Velcros in on itself.
So you'll see on the back, you get right at the bottom of that kind of gluteal fold, and on the front, again, as high as you can comfortably get it on the patient in their upper thigh.
So then you can pump it up with the detachable pumps to the correct amount of pressure, which is different for whatever cuff you're using and what body part you're using. Once you pump it up, then you can detach it, and so then he's free to go around the clinic and do whatever exercises you want him to do. Same thing if we were to do the arms, is again, it's going to be kind of up as high as it'll go. So if we want to take this off, you release it, take the pressure off, and it'll be good to go after that.
Again, no matter what, if you're talking about arms or legs, there's only two places to put the BFR. Arms right below right at the deltoid insertion, right above the biceps, the muscle belly of the biceps, and then as high as you can comfortably get it on the thigh. And again, like Dave, that little trick, a lot of times we like to angle it up a little bit in the back. We do it over clothing, it works a little better directly on the skin, but once you get that pressure into these cuffs, they're not going anywhere. So just for the lack of cleaning and keeping them disinfected, we do over clothing all the time, and once you get them inflated, they don't move even though you're doing exercise.
Yep. And so for the arm, again, same thing. We're going to put it up pretty high, just below the deltoid. And again, this is even if you're trying to work forearm muscles or muscles proximal to the cuff, like the shoulder or anything like that. Velcro it down, and then same thing. Put it in, pump it up to the desired amount of pressure, unhook it, and then he's good to go from there. So there's just kind of a quick delineation between different types of bands. Again, the main thing to keep in mind when you're looking at getting bands is what's the makeup of the band. Is it rigid or is it elastic? And then what device do they have to make sure that you're not fully occluding? Some of the bands just intrinsically are unable to fully occlude, like the B-Strong bands. That's just part of their system. Some of them will have a Doppler that comes with it that you need to check and kind of recheck to make sure you're not doing it. And then some of the more expensive ones have an automated system in place to make sure you're not fully occluding. But those are the kind of important things to keep in mind when it comes to band makeup and band placement.